And this month we have a fantastic speaker. This is Dr. Gerber, and Dr. Gerber is a family practice physician. His office is actually located on the Littleton Adventist campus, so that's really nice. A couple pieces of information about Dr. Gerber. As I mentioned, he's board certified a family physician. He came here from Pennsylvania in 1993 and really loves the outdoors and playing tennis and all that with his family. So he's going to talk to you today about good nutrition and healthy choices. And without further ado, I'll pass it on.
Thanks, Katie, and I also wanted to thank April and Holly Creek and all of you for coming today. So I do like sports, but I'm also passionate about nutrition and helping patients. And so today I'd like to talk to you a little bit about nutrition as we understand it in the 21st century. Now, we're a small group. I have a lot to go through, so maybe one or two questions in between. But the way what I'd like you to do is to kind of throw away everything that you understand about nutrition or have learned over the last 60 plus years and kind of just free your mind and listen to what I have to talk about today and see if it makes sense. And as a way to discuss nutrition, I'd like to discuss the obesity epidemic and related healthcare issues. And to summarize what we're going to talk about today, first I'm going to give a timeline, and we're going to look at the history of obesity, nutrition, dietary guidelines, and we're going to look at various government bodies and see how they contribute. We'll look at industry. Then after that, we're going to discuss some of the associated medical conditions with obesity and discuss some newer conditions that you may or may not have heard of and talk about them in a little bit of detail. And then we're going to discuss some of the driving forces for hunger and appetite. Then we're going to go into the evaluation, management, treatment of obesity and associated medical conditions. Then the fun part, I think, is at the end where we're going to talk a little bit about comparing diets. And then we'll summarize with nutritional guidelines. So with some of the history, traditionally we have considered obesity to be a lifestyle issue. It's my fault. It's not a medical condition. You have to go out and find a solution for yourself. You feel guilty because you're overweight. You know, what have I done wrong? I didn't listen to the advice that was provided to me. The relationship to health was foggy. And as a result, we developed a billion-dollar weight loss industry. Weight Watchers is a great example. In 1960, or in the 60s, it was developed by a group of entrepreneurial women in New York City. And they obviously did quite well. And the question is, was it scientific, was it not? I believe they did use the science of the time to come up with the recommendations. But I think what's important is they said to pay out of pocket. Hopefully that's the pointer. Okay, no pointer. Is there a pointer?
Yep, very top.
Oh, okay. Okay, it's not working. Okay, so then we have one government body, which basically is, well, two government bodies, that's public health. And the USDA, Department of Agriculture and Health and Human Services. There we go. That's much better. And basically what they started doing post-World War II is come up with nutritional guidelines. But what's important is the guidelines were based on preventing malnutrition. They weren't considering nutritional excess. And so what they came up with was the basic 7, and they condensed it down to the basic 4 groups: bread, fruits and vegetables, dairy, meats, those kinds of things. Then the McGovern report comes out and he wants to eradicate malnutrition. In 1980, the dietary guidelines tell us that fat and cholesterol are the problem, and there's this whole cholesterol hypothesis that was really created back then that said cholesterol is going to kill us, fat in the diet, that's going to kill us. And that's where all this had come from. But they said, so decrease the fats, and what you do in turn is increase carbohydrates. Back then, carbohydrates didn't seem to be a problem. In 92, we come up with the carbohydrate-heavy food pyramid, and they keep updating it. And getting there, but it's still off the mark. And again, this was based on the science of the time that I just talked about, preventing malnutrition. They wanted to make sure that you got your daily requirement. They didn't consider excess. And the science of the time, eat fat and get fat. That doesn't sound very scientific to me, but that really was the working operative. And physical activity was not really in the equation at that time. So then we have the health insurance industry. I guess I work for them, or maybe I don't know. But and that's really comprised of Medicare and Medicaid, and they basically, well, Medicare was funded by Social Security, but the point is that they basically drive the rules in healthcare. And what do they say? They say that we're going to pay for the treatment of illness. We're going to put out fires. We're not going to pay for any preventive services. And again, in this lifestyle model, obesity is not a medical condition, so they're not going to pay for it. They say, well, we have public health programs. The public health department gives guidelines, and so you should listen to those guidelines, and then you have to pay out of your pocket to seek treatment for the issue of obesity. And what does that do to the providers in healthcare? The message is, we're not going to be paid to counsel patients or to treat patients for issues of obesity and issues related to obesity. And in the medical schools, they don't teach doctors about nutrition. They don't teach us about obesity. And you come to your physician and your doctor, I have a problem. And in the old school, they would say, well, go lose weight. We don't know much about that. We're not going to get paid to talk to you about that. Now, it's changing. That's the good part. So then we also have the food industry, and so they're all about profitability, big money, enterprise, and so they develop quick, cheap, inexpensive junk food that's filled with fat and carbohydrates. The concept of this fast food where they're supersized and we eat and eat and eat. There's this concept of healthy food, which is low fat, but it's high in carbohydrate. And then we have the American lifestyle. And the point there is that genetics contribute, but over the last 100 years, genetics haven't changed. But what's changed is our abdominal girth. So it's really more of a lifestyle issue. But we have this self-indulgent couch potato population where we overeat. I'll tell you, some would say, well, we're just being gluttons may be part of it, but I think that we're here today to discuss nutritional guidelines and update them because they're missing the mark. And some are trying to follow those healthy guidelines, but they're struggling. And again, because there's something wrong with the guidelines. And so what we have from this is an epidemic. And the Trust for America's Health, I guess in the late 2000s, they started coming out with yearly reports. This is the group that says Colorado is the leanest state in the country. And that's wonderful. So we're actually at 19.1% in terms of the obesity rate in our particular state. But that number actually each year it rises, where Mississippi is the heaviest. But what they tell us is we get a failing grade because we're not doing well. And presently 2/3 of adults are overweight and obese, and approximately, 25% to 1/3 of adults are presently obese. And then the child statistics, 1/3 of our children are presently overweight and obese, and the rate's tripled since 1980. So my conclusion is that this whole lifestyle model isn't working. Something has gone wrong, and of course we want to blame somebody, and I blame myself because I'm a baby boomer also. I'm at the tail end of the baby boomers, and I just turned 50. I heard that. I said I don't look it. can't blame us, but I think we tried to give good advice based on the science of the time, but again, it's hard to miss the mark. And now we're stuck that we have this common sense eating. You know, eat low-fat food, eat low-fat food. It's on the TV, it's everywhere. Low-fat this, low-fat that. And how do you change this common sense thinking that we have? What also has happened is now we're spending billions of dollars treating the complications of obesity. Heart attack, stroke, diabetes, you name it. And that's kind of like spinning your wheels. Why not treat the primary cause, the obesity issue? And the point here is that the healthcare community, Medicare, Medicaid, we can't ignore that there's this epidemic that really is a medical condition. And you know, the healthcare industry needs to participate in attacking this epidemic. And so this is where the medical model holds promise. And this is how I operate every day as a family doctor. I treat medical problems. It's a scientific approach. And we look at obesity as a medical condition. And furthermore, what we want to do is look back in time and say, well, how did we get here? And then we recognize that it's a medical condition. We're not, I mean, it's nice to lose weight, but the goal is to improve health. And so we're kind of doing the two things at the same time. And for me, it's really the science of medicine that provides clues. And so, like Sherlock Holmes would say, the problem is with the food. And the science is the medical conditions that teach us better nutrition, specifically insulin resistance, which one of the conditions that we're going to talk about in